Hello learners, today we will be discussing about the different factors affecting the dose of a drug. There are many crucial factors to be considered before altering your patient's dose. Check out those important factors. The first factor the pharmacist looks into before prescribing a dose is the age of the patient. As the human grows up, there will be a drastic change in all physiological and metabolic parameters like water and fat content, metabolism, liver and kidney functions. These defining parameters are determining the stay and action of the drug in the body. Age is considered as the easy anchor for better dose regulation. So, your age decides your dose. Isn't it interesting? Let us see how weight and surface area of the body is going to affect the dose calculation. Is the dose same for a fat person and a lean person? No, it is not always the same. A fat person is evidently heavier, with more surface area. At the same time, he definitely has many physiological and pharmacokinetic functions altered, compared to the lean person. To cope up with these changes, and to get the optimum drug effect during the treatment, dose alteration is obvious, and a rather high dose is advisable for obese patients. Usually, antibiotic and anti-cancer dose calculations are done on the basis of body weight and surface area. These are some examples of dose changes according to age, body weight and surface area. Let's see how genetic factors are affecting the dose of a drug. Genetic constitution of each individual is unique, and that makes the person who we are. The amount of metabolizing enzymes, the receptors for drug absorption, distribution and the binding proteins, all depends upon the genetic makeup. The onset of action and duration of action of the drug, all depends upon the extent of pharmacokinetic parameters. That's how genetic makeup is playing a great role in the effectiveness of a treatment. Let us discuss some examples. Drug action of dapsone and hydralazine depends upon acetylating enzyme, produced by liver. Genetic constituents decide the quantity of this enzyme in the body, so dose alteration should be done, according to the quantity the enzyme produced. Succinylcholine is a muscle relaxant, given prior to surgery, and tracheal intubation. The effect of the drug is only last for 3 to 5 minutes, because of the rapid metabolism by butyrylcholinesterase. But for a patient with a genetic disorder, pseudocholinesterase deficiency, the normal dose of succinylcholine would paralyze the respiratory muscles up to 8 hours. That means, it is dangerous to administer this anesthetic agent to them. Otherwise, a serious dose alteration is needed. A check in the enzyme before the procedure is also advisable to avoid complications. Let's see how the existing diseases can be a cause of dose alteration. Diseases like liver cirrhosis, renal failure, congestive heart failure, and hypothyroidism affect the metabolism in a negative way. Even the normal dose can be dangerous for patients with these diseases. Check out the examples of drugs used carefully with these existing diseases. Most of the time the dose of these drugs is altered. Let's discuss some examples in detail. Most of the HIV/AIDS patients are prone to a number of gastrointestinal disturbances. This greatly affects the absorption of orally administered drugs. Indinavir, which is widely used for the treatment of HIV, needs a prefect acidic environment for its absorption. But HIV patients with achlorhydria, this drug will not be absorbed satisfactorily. So, during the treatment, a close monitoring of serum concentration of indinavir, and altering the dose, assure the success of therapy. Levodopa, which is used to treat Parkinson's disease, shows a very low absorption because of the gastric motility reduction. Here also, dose alteration is the only option for better results. Contrary to the previous examples, celiac disease is associated with increased gastric motility. Therefore, an increased and irrational absorption of drug is always experienced from the gastrointestinal tract. So, a dose reduction would be suggestive in celiac disease. Route of administration is the next important factor considered for dose alteration. You see, a drug administered orally has to cross many barriers before reaching the site of action. A large percentage of drug is lost during this travel and the onset of action is delayed. But, drug through intravenous or inhalation reaches the site of action in no time with 100% of bioavailability of the drug. So it is obvious that, the dose for these direct administration routes, will be less compared to others. Check these drugs and its doses. There is a huge difference in its doses when administered directly and orally. Time of administration also plays an important role in drug action and dose regulations. Your pharmacist will tell you when the medication has to be taken, whether it is before food, after food, or at bedtime. It is important to know that the absorption of drugs is affected by the presence of food. These are some of the well-documented examples of effect of food on absorption of drugs. Absorption of drugs can be increased, decreased, or delayed by the presence of food. Look at this graph. It shows two plots. The first one shows the serum concentration of theophylline when taken with food. The other one explains the concentration without food. It is clearly evident that with food the concentration has risen to a toxic level, and the patient experienced side effects like vomiting and headache. Contrary to the theophylline, posaconazole is always advised to administer with meals to achieve desired plasma concentration. Sex of the patient also will be considered while prescribing a drug. Both the genders have notable difference in body weight, fat content, lean body mass, and fat mass. These parameters should be considered for fixing a dose. For example, minoxidil topical preparation has a difference in the dose for both the genders. Apart from sex, dose alteration is strictly followed for pregnant and lactating women. When I am saying that environmental factors have a strong effect on drug action and its dose, it would be difficult to believe. Let's see the case of CNS stimulant. This has to be taken in the daytime. If you are taking it at night, a larger dose would be needed. Same is true for CNS depressants. We can understand tolerance better with the example of alcohol. When you are a routine alcohol drinker, even if you are consuming large quantity, you may not feel the effect of alcohol you used to get with a small quantity during your initial drinking days. What could be the reason? This is because of tolerance. It is the body's adaptation to higher dose of drugs. Body exhibits this phenomenon in order to tolerate a high dose. Body has made some alteration in the metabolic process and receptor sites. Serious dose increments can be done with these drugs. It is also important to know that the drugs which show tolerance are prone to addiction. Amphetamine, morphine, and oxycodone are some of the examples of drugs exhibiting tolerance. Next we will see how combination drugs are going to affect the dose fixation process. Okay, just answer this simple question. What is 2 plus 2? It could be always 4, that is the proven and expected answer. It is the sum of the individual values, that means the additive value. Now look at this McGill Pain Index scale. It says how much effective each category is of painkiller for managing pain. For example, suppose aspirin is having a pain index of 7. It can only treat some sprain pain, but when it is combined with codeine phosphate, which is having an index of 13, it can relieve even the severe toothache. So here the final clinical response is the exact sum of the individual effect of the drugs. This is called as additive effect. Combination of paracetamol and ibuprofen is another example of additive effect. Most of the additive effects are beneficial, but dose monitoring and alterations are always crucial for drugs with narrow therapeutic index. Whether 2 plus 2 can be 8, but if it can be true, it is an exaggerated effect and you are not expecting that answer. You are expecting the answer as 4, but if you are getting 8, it is something more than expected. Same like that, synergism is an exaggerated effect obtained when two drugs are combined. It would be always bigger than the expected additive effect. Isoniazid and rifampicin are bactericidal antibiotics used for the treatment of tuberculosis. Their combination exhibits highly beneficial synergic effect. Contrary to synergism and additive effect, antagonism is the nullification, or the reduction of the effect of one drug by the other when used in combination. For example, when insulin is used along with glucagon, there would not be any change in the blood sugar level. These are some of the examples of combinations of drugs exhibiting additive, synergistic and antagonistic effects. In order to avoid toxic reactions, it is very important to carefully regulate the dose in most of these combinations. It is the pharmacist's duty to check for these effects before prescribing combinations of drugs. Ever wonder what if the drug administered into the body fails to excrete? If it happens, the drug starts to accumulate in the body and produces serious side effects. Accumulation can happen after repeated and continuous administration of drugs. It happens mainly because of the binding of drugs to some selective receptors and failure to clear it off from the sites, and the slow metabolism and excretion of drugs. Check some examples of drugs displaying accumulation. As a pharmacist, what will you do when a patient starts to show signs of drug accumulation? Intake of other substances, along with drug, will also affect the drug action. This will lead to either increasing or decreasing the action, or to some unwanted adverse reactions. Patients should be informed about the signs and symptoms of food reactions when taken with certain drugs. Many times, dose alteration would be a routine practice if the patient cannot avoid those interacting foods. Some examples are given for your reference. Idiosyncrasy reactions occur only in some patients for some drugs. It is an unusual response observed for a normal dose of drug. For these reactions you can blame nobody but your genetic makeup. Idiosyncrasy reactions are not considered as drug allergy, but they are adverse drug reactions. The dose alteration may not help to avoid idiosyncrasy. A complete discontinuation is required. Serum sickness, Stevens-Johnson syndrome and drug-induced lupus are some examples of idiosyncrasy reactions. Go through some of the other such conditions and their symptoms. Tachyphylaxis is the sudden and acute loss of drug action. Let us pay attention to a conversation between a doctor and patient. The patient is panic after experiencing tachyphylaxis, and the doctor is suggesting the remedy for his problem. Let us understand, unlike tolerance, drug action cannot be increased by increasing dose, and can be restored after discontinuation of therapy. Ephedrine and amphetamine are the examples of drugs showing tachyphylaxis. Wonder how the psychological factors are going to affect the drug dose. You'll agree me if I say that your emotions affect your body and its functions. Because of this, body may not be able to respond to the drugs as expected. Look at this example. You can see an extremely tensed patient in a surgery room. The usual anesthetic dose may not be sufficient for him, and the dose need to be increased. Same way, the dose of a calming agent given to schizophrenic patients is much higher than a normal patient. Do you believe sometimes a placebo can better work than a drug? Yes, it happens. Your physician and pharmacist prescribe it to you if they feel it can help you psychologically. Thus, psychological and emotional factors also play a great role in dose fixation. So while prescribing a drug and its dose, pharmacists have to consider all these 17 factors. Even a small mistake can be proven dangerous to the patients. Hope you have understood the concepts. Please do write to us if you have any queries.